Hi, my name is Dr. Eugene Wada. I'm here to talk to you about thyroid problems. I have hundreds of hours of studying seminars, postgraduate studies in thyroid under the guidance and mentoring of Dr. Tatis Karazian, who wrote this book, Why Do I Still Have Thyroid Problems, Symptoms when My Lab Tests Are Normal. This is a groundbreaking book on the functional medicine approach to thyroid problems. Thyroid problems are one of the most mismanaged conditions in the country today. So a lot of people have thyroid problems and they don't even know it. I have a lot of patients with chronic problems that come in, and we diagnose them with a thyroid problem because a lot of the problems are directly or contributed by the thyroid gland. Such patients such as weight problems, people come in for weight problems. I have one patient, she came in and she has a thyroid problem, but she also had a weight problem. And so we put on our protocols to treat her thyroid, and within about a month and a half she lost at least 30 pounds. And she's just pleased, really pleased that she was able to lose the 30 pounds. And she said that she went to Weight Watchers and Weight Watchers didn't do anything. She had been on other diets, self-dieting, exercising, and she still couldn't lose the weight. So with this approach, it wasn't her weight loss problem, it was her thyroid problem that was really the problem here. So we also had patients coming in with vertigo, dizziness, balance disorders, and we found that maybe the thyroid problem was a problem too. And yes, that was the case. In one of our patients, he had a thyroid problem, and so we treated him for thyroid also, and also with other treatments for his balance disorder, and of course he got better, and that was a very good success story for us. There are a lot of patients with thyroid problems and they don't even know it, and because they don't put it together with the thyroid problem. And some of the conditions that people are experiencing are chronic fatigue, difficulty losing weight, their hands and feet are cold, their hair is thinning or falling out, they're constipated. So those are some of the signs and symptoms of thyroid. So if you have any of those, it's possible you have a thyroid problem. A lot of people have a thyroid problem. They've been diagnosed with a thyroid problem, so their doctor put them on medication, thyroid hormone replacement. But what they're trying to do is get your thyroid stimulating hormone within normal lab ranges, right into the range. And if they can do that, then you're fine. But in essence, a lot of patients say, you know, the doctor is doing his best to get my TSH in level within lab range, and when they do, I still feel bad. Why is that? It's because there's 23 different patterns. The only one pattern that medication will work for is called primary hypothyroidism. Only 10% of the people who are diagnosed with hypothyroidism have that. So if you have primary hypothyroidism and your medication is working for you, then you're home free. You may have to adjust the dosage in the future a little bit, but that will work for you. But for all the other 90%, what do? They're running around crazy thinking, geez, you know, they got my hormone levels within normal range, but I'm still having these problems. My hair's falling out, I'm overweight, I feel tired all the time. So what do? Well, the mechanisms, there's, like I said, 23, one being primary hypothyroidism, the other 22 I can't get into, but let me give you an overview of what the thyroid patterns are like. You have the T4, which is made by the thyroid gland. The thyroid gland produces T4 and T3. It produces 93% T4 and only 7% T3. T4 is an inactive form of thyroid hormone. So it has to be converted to T3, which is the active form of thyroid hormone. The way it does this, it's converted in the liver. 60% is converted in the liver, and it's also converted in the gut, and 20% is converted in the gut. So if you have a liver congestion, a liver condition, maybe bacterial infection, parasitic infection of the liver, that is going to affect the conversion of T4 to T3. If you have a same thing, a parasitic infection, a bacterial infection, a dysbiosis, a yeast infection, any kind of food intolerances, that can affect your gut. And that produces or converts 20% of the T4 to T3 in the gut. So if you have any of these problems, we have to look at both these areas to see if you have this problem going on. Otherwise, you're not going to get better. Okay, that's why your thyroid gland could be working perfectly, and it's not your thyroid gland that's the problem. It's the conversion of T4 to T3 in your gut, in your liver. So that's just an overview. There's also other things that are come into play if you're taking estrogen, birth control hormone. That can also have an effect on the transporting of this T4 to your liver to be converted to T3. So a lot of patients who are on hormones for birth control will have thyroid problems too. So these are some of the things that can cause thyroid problems. Not all of them. Like I said, I don't have time to get into all of it, but I got to tell you, you're probably asking, well, what makes me different, right? So let me tell you, what makes me different is I do a lot of testing. I test to see where what's happening with you. We do a full, complete blood workup, including a full thyroid panel, which is your TSH, T4, T3, free T3, free T4, T3 uptake, and antibodies for your thyroid gland. All right, so we also do adrenal stress index for cortisol levels. We also do stool analysis to find out if you have any kind of bacterial infection in your gut. And also the blood test will also show that we do before, I was talking about before, will also show liver problems, and if you have an infection. The CBCs that we run will show if you have infection in your body somehow. These are all things that we have to look at. We also do food intolerance tests, intestinal permeability testing. So without all this testing, we can't really tell what's going on with you. It's kind of like finding out what the pieces of the puzzle are and putting them together for you. And everyone's going to be different. Some may have different things going on with them. So everyone has a special case that we have to look at. So that's what makes us different as far as looking at this. We don't treat diagnoses. We treat the patient. We treat the person. We try to get the person's function, the physiological function, to work better, so everything will start to function better. So with your thyroid gland, we need to find out what's going on with you, why you're not getting the thyroid hormone into your cells. Okay, so that's what makes us different. If this is something that you are interested in, I would encourage you to call our office at 310-516-9989 and set up a free consultation. I'm willing to do a free consultation for you. It'll probably take about 30 minutes, but what I want to do is find out if you're a candidate for this program and if functional medicine is something that will help you. Okay, so give us a call, 310-516-9989, and I strongly urge you to take me up on this offer. Thank you.